welcome back. I want to talk today about levothyroxine versus Armour Thyroid. Okay, what is levothyroxine? What is Armour Thyroid? So the topic for today is thyroid treatments. What are the options that you have? Okay, so when we diagnose you with thyroid disease, we know that a lot of times lifestyle changes, holistic therapies sometimes might not fully bring your thyroid function back. And when that is the case, we do have to treat you with hormone replacement using thyroid. Now, there are two options here. We have the conventional treatment, which is using synthetic thyroid hormone called Synthroid, or the generic of that is levothyroxine. Or we can use what we call the natural thyroid hormones, things like Armour Thyroid, Thyroid, MP Thyroid, Westroid, and so on. Okay? These natural hormones, we call them, come from the bovine animal, right? The pig. The gland of the pig, the thyroid gland of the pig, is very identical to the human gland. And so the hormones that come out of it are very similar. Okay? So because of that, we can take a dried up bovine thyroid gland and take some of that and make it into these medications we call the natural hormones. When we give patients these hormones, it doesn't just contain a synthetic T4 like what the Synthroid and the levothyroxine has in it. It has more than T4. It has T3, it has T7, and a few other hormones and cofactors in that gland. So we find that by replacing the entire ingredient in the natural gland, some patients respond better and do better and feel better than patients on just Synthroid, which is a synthetic T4. Looking at blood work when we're treating thyroid hormone is not enough. What do I mean by that? Well, a lot of times I have patients come in and they've been on their Synthroid or their levothyroxine for a while, and their blood work looks normal, meaning the TSH level looks fine, the T4 level looks fine. But these patients don't feel better. So if you're on thyroid medication and you still don't feel better, some of the reason might be that your body really wants the remaining cofactors inside of that gland. So like the T3 or the T7 or the other cofactors, okay? So we find that when we switch these patients sometimes to these natural versions, they sometimes do better. In fact, they start reporting that some of their symptoms, their fatigue, their brain fog is being lifted after a few weeks on these natural options. It doesn't work like that for everybody. Some patients do great on the Synthroid and their body is able to convert it to the active T3 and they do awesome. But if you're that patient that you've been taking that Synthroid but you're still struggling with your weight, even though you're exercising, you're eating right, you're on a weight loss plan and everything, and you just keep struggling, it might be something to discuss with your provider to give you a trial of some of these medication. And some of you might ask, why didn't the doctor just try that anyway? Well, a lot of insurance companies cover the synthetic Synthroid or the generic of it called levothyroxine. And there's a huge pushback on covering the natural. Whether it's because of the cost, whether it's because of like formulary plans, it's hard to say. But sometimes your doctor might need to do a prior authorization, explain that you've been using the synthetic Synthroid and it's not working well for you, and that's why they want to try you on the other kind, right? So that's something that you might have to have a conversation with your doctor, and hopefully they're willing to make that, fight for you so that you can get this medication. I routinely run into patients on Medicare that Medicare does not like to cover this routinely. So we always have to do a prior authorization explaining that, hey, yes, my patient has tried the synthetic, they've tried it for a while, we've even switched brand of synthetics, and still they are struggling. So let's try the natural, let's see how they do, let's see how the labs come back and go from there. So very important, not just to take the medication, but also to make sure that after you've taken the medication, the doctor is checking your levels correctly. They're checking your T4, your T3, your TSH, right? Your antibody levels, not just the TSH, okay? So why do I usually say free T3 and free T4 and not just say T4 and T3? Because the free T3 and the free T4 are the actual levels that matter. Those are the ones that actually cause an effect at the cellular level, okay? The total T3 and total T4 is just what's floating around in the blood. Sometimes are bound to proteins and cannot be used. We want the ones that are free, available, bioavailable levels of these hormones. That's really what we want to look at. So make sure that's what your doctor is checking, that's what you're following and monitoring to see what's happening, and that's how you get better from your thyroid disease. Hope this has been helpful. I'll see you on the next one. Don't forget to hit that subscribe button. Make a comment in the section below if you're one of those patients that have tried the Synthroid and tried the Nature Thyroid, and let us know how you did on one versus the other. And I know there are going to be patients out there that, you know, the natural one didn't work for them at all. They had to switch back, and that's fine. We want to hear from you too, because everybody's different. We will learn from your story or what's happened in your case. I'll see you on the next one.